in general. So we're extremely privileged to have with us Professor Jo Vieri from the Africa Center for Migration and Society at Wits University, and she will be sharing a few thoughts with us around how we stop to think about HIV, health, and migration on a day when we are commemorating International Migration Day. Jo, over to you.
Thank you, Diego, and morning, colleagues. As you say, Diego, sort of coincidentally, International Migration Day coinciding with World AIDS Day, and I think it is an important moment to sort of take stock of where we are. We sit in a moment within South Africa where, on the one hand, we're sitting with a crisis after the withdrawal of US aid funding and PEPFAR money that were specifically providing, using funds to provide specific services to often marginalized groups, which includes migrant groups, people coming from other countries who are living in South Africa. And at the same time, we're living with potentially some hope with the new HIV prevention vaccination and thinking about rollout next year and what opportunities that might bring for reaching hard to reach groups. There's been a lot of emphasis on the importance of continued access to treatment, not only for people living with HIV, but also as a pre-exposure prophylaxis PrEP. So using treatment as a way to prevent new infections. And the country had been making very good progress around these targets, looking globally. But we now sit in a moment where we're only going to be seeing in the next couple of months the real impact of the sudden withdrawal of these funds and what this means for a public health intervention, an intervention that must be accessible to everyone in the country, regardless of migration status, citizenship status, and without ensuring access for everyone, we're not going to continue to make headway in the attempt to ensure that HIV becomes something of the past rather than a continued challenge. So this is really about thinking through the current context and really recognizing the kinds of opportunities we have moving forward, what is strategic, thinking about, like I say, the vaccine, but also thinking about NHI and the country's progress towards universal healthcare coverage.
Sorry, Jo, you seem to have muted yourself.
Oh, oops, can you hear me now?
Yeah, you're back.
Just to remind ourselves of something very important that Dr. Motsoaledi, the Minister of Health, said this time last year. And he was reflecting on the theme of last year's World AIDS Day, which was about equal rights and equal care. And he really emphasized the importance of a renewed commitment to addressing inequalities and ensuring equitable access to quality healthcare services. And he emphasized the need to focus on vulnerable and marginalized communities. He here refers specifically to migrants and recognizes that when we have punishment, discrimination, and stigma, we lead to failing public health as these communities, such as migrants, are pushed away from vital health and social services. And really recognizing his recognition of the need to advance equality and fairness for everyone, regardless of gender, age, sexuality, ethnicity, religion, or HIV status. One of the first things that Dr. Motsoaledi said when he returned to being Minister of Health was the need to rethink the NHI, the National Health Insurance, which currently excludes asylum seekers and undocumented migrants from accessing primary health care. And this includes restricting and removing the right to access HIV treatment or HIV pre-exposure prophylaxis. We have to recognize what a challenge this presents, as he did, and he said that he would be committed to ensuring that this was not the case within the NHI. So I'm hoping that he will be remembered of this and the importance of this, particularly in light of the withdrawal of funds that we've seen, to recognize why it's so important to include everyone in our interventions. We saw this successfully, although albeit late, but successfully when we were in the middle of the COVID pandemic, in ensuring that everybody had access to a vaccination. We knew that without ensuring access for everyone, my vaccine means nothing if everyone can't be vaccinated. And I think we need to remember that and look back at that as a time that was around a successful public health intervention that was inclusive of all. So unfortunately, in spite of these sorts of remarks from the minister, we have people like Gloria, which is not her real name, who had experienced many challenges during her pregnancy. And one of the things that we were hearing a lot about, and this is the case now too, this is from a director of a sexual reproductive health rights program. This is a public health program. You have people being turned away from the ARV program, antiretrovirals, because they didn't have the official ID documents. It's ridiculous because lots of South Africans didn't have the ID books. And this is something that we're seeing manifest again and again. And at the moment, particularly acute when we look at the work of vigilante groups outside clinics, Operation Dadula, March to March, and others, and the fact that we're not policing and managing those spaces effectively. The reduction in the number of people accessing services is very notable, and it's not only foreign nationals who are afraid to access or try and access services, but also South Africans and pregnant women and others who would have been previously accessing HIV treatment and prevention services. If we look at xenophobic discrimination over the past sort of 10, 12 years, we've seen that the amount of violent discrimination has been an issue all along. And if we look specifically at the last 2 years, this is a heat map that shows you where incidences of xenophobic discrimination are located and where they sort of center around particular urban conurbations. This is work from the XenoWatch program at the ACMS. This is the same data, but shown slightly differently, looking at the distribution of these forms of xenophobic violence. Again, we can see clustering around Cape Town, Joburg, Nelson Mandela Bay, and Durban. When we look at what the most common forms of xenophobic discrimination incidences are, whilst we see direct violence being the most common, it is important to recognize that health xenophobia is a big issue. And this is something that was pre the current acute events we're seeing at the moment with Dadula and others attempting to prevent access to primary healthcare clinics for those who are supposedly without identity documents. Between February and November this year, a range of incidences of health xenophobia, so people being prevented from accessing care, have been recorded. We know that there are more incidents than are recorded, but this is a good indication of where we're seeing the most action and the most active, where Operation Dadula and others are the most active, again with Gauteng being the most affected. One of the challenges that we sit with is around issues to do with policy, issues to do with frameworks and issues to do with legislation. Whilst on paper, until we had the NHI come in, we did have some very progressive and positive approaches in attempting to ensure equitable access to healthcare. One of the challenges that we see and we have continued to see is at the level of individual health facilities or at the individual provincial level, for example, seeing different pieces of interpretation of legislation or of different frameworks being developed at the facility level. And here, this is where we're seeing huge challenges around what the Constitution and the National Healthcare Act say versus how separate facilities would be choosing to interpret that policy. Now, mistreatment from healthcare providers is something that many migrants experience. And it's important to emphasize here that that isn't the case of all healthcare workers. And this includes thinking through people's journeys into facilities, right from security guards, through receptionists, through data clerks, and so on. and the kinds of ways in which people are prevented from registering and accessing care. Now, as of several years, this confusion around primary health care and then around co-payments in hospitals for higher levels of care, we know that there are issues that remain around documentation, but there is no requirement legally for somebody to have, for example, an ID document or a valid passport. Like South Africans, there are other ways to prove identity, obtaining an affidavit, for example. But this all requires foreign nationals in particular to have to engage with different state actors. So one of the things important to remember is that we're talking today about two things that are related to a third. We're talking about the international migration governance agenda, whether we're thinking about the global compacts, we're thinking about the global health agenda, particularly thinking through World Health Assembly resolutions relevant to migration and health, but also around universal health coverage and disease prevention and control programs, today obviously HIV. All of these are linked by the Sustainable Development Goals and the broader ambitions of a development agenda. We know that migration offers opportunities for social and economic development, but if we can't ensure that those who move remain healthy, we lose out on those potential benefits. The World Health Organization is taking a leading role globally in pushing the refugee and migrant health agenda. And this is through several interventions, importantly, the Global Action Plan on the GAP on promoting health of refugees and migrants, which has been extended until 2030. This has 6 key priorities that are shown in the box on the bottom left, looking at promoting health, promoting continuity and quality of essential healthcare, looking at ensuring we advocate mainstreaming of refugee and migrant health into global, regional, and critically country agendas, that we need to enhance capacity to address social determinants of health, that we need to strengthen health monitoring and health information systems, and we must support measures to improve evidence-informed health communication to counter misperceptions about migrant and refugee health. And I would argue, whilst that's number 6, that's actually the most important, and we all have a role to play in that. Something that the department recently undertook at the beginning of this year with the World Health Organization was work around developing a migration and health research agenda, as well as assessing the country's health system's capacity to respond to migration and displacement. And these are all very positive interventions that suggest that the department is committed to addressing the needs of different migrant populations. How that looks like as we move forward obviously remains to be seen. A very important document that was produced last year by the department, and something that has been very welcomed, is around a zero draft policy advisory that was prepared for the National Planning Commission. And this, coming from the Department of Health, is incredibly important. It indicates clearly that one of the most important steps in achieving South Africa's universal health coverage objectives is around addressing health disparities for migrants and refugees. The country can create a health system that's resilient, inclusive, and sensitive for all citizens, including migrants, by implementing policies that address workforce distribution, healthcare access, and resource allocation. And adopting these recommendations will increase the country's commitment to social justice and equity in healthcare, assist sustainable development, and be in line with national priorities. And this is particularly critical when we're thinking about communicable diseases and notably HIV. I'm going to finish now, but a reminder here, and this will be launched either later this week or next week, the Collective Voices for Health Action and for Health Access have put together an important information leaflet which talks about the right to healthcare in South Africa. And it's for everyone living in the country, and the document is there to support citizens as much as it is to support people who move within the country and people from other countries. And it's really essential that we do what we can to work and support our health system in responding to HIV in inclusive ways. This is particularly important given the current context of a reduction in funding and an abrupt reduction, but also the activities we see vigilante groups undertaking and concerns around how that might spread next year, thinking around, for example, school access for children. So I'll stop there, and thank you, Diego.
Thank you very much, Joe. This is a presentation very well received and very much appreciated. I think what is evidently clear here is a dual approach, or a dual manifestation of how healthcare access to migrants is coming across, whereby on the one hand, legislation indicates one thing, indicates access to all people for primary health care treatment. On the other hand, we see that on the ground there are different realities, notwithstanding the activities of vigilante groups, which are having a profound impact. On World AIDS Day, we should also bear in mind the impact of having interrupted HIV treatment and what that does towards creating a drug-resistant strain towards HIV, and the impact that can have for the broader population at large. So thank you so much for that presentation.